The reason I've decided to pursue a career in medicine, and specifically cardiac surgery, is the impact that a physician can make on a patient one person at a time. I've always found that to be extremely gratifying. My name is Wilson Szeto. I'm an adult cardiac surgeon. My current role is the Chief of Cardiovascular Surgery at Penn Presbyterian Medical Center. My personal approach to patient care is one of compassion and advocacy. I would hope that patients will see me as their strongest advocate in providing them the latest cutting-edge care available today in aortic surgery. The Penn Aorta Center is an exciting initiative here at Penn. It is a comprehensive program that will offer the latest treatment and technology for all patients with aortic disease. With this new model, the concept and focus will be creating a broader team to offer the best care possible to our patients. And a team approach including not only the surgeons, but also experts in imaging, medical management such as cardiologists and geneticists, and the latest treatment options beyond surgery. What is so important and so exciting about the evolution of our program is that we will be able to put the most important aspect of our team in the middle of all of this, which is our patients. The best part of my day is getting to know my patients and interacting with them and allowing me the ability or the opportunity to reassure them that everything will be okay.